So now we're going to go into your family history. Okay. So we're going to talk about your parents and grandparents in that frame. Okay? On both sides of your family.
Okay.
So any history of high blood pressure, cancer, diabetes, or anything like that with your parents on either side?
My grandpa had heart trouble. He died of a heart attack.
Okay.
And then...
Do you remember how old he was when he died?
No, I know it was around 1985 or 6.
Okay.
I think he was in his 70s, maybe.
70s, okay. How about stroke? Any history of stroke?
No stroke history.
Okay. So just the heart problems with your grandfather is the only thing that stands out to you. Okay.
Yeah, and my dad has asthma too. So
your dad has asthma,
yeah.
And so no cancer or anything in either side of the family. Okay. If you think of anything else, let me know. Okay.
Okay.
Okay, so now we're going to start talking about the review of systems. So I'm just going to ask you questions about different systems in the body. So is there any questions you have about anything we've talked about so far, or anything that you feel like we want to add to what we've talked about? Okay. So let's talk about your skin, hair, and nails. So in the past, have you had any issues with redness, any changes in color to your skin tone, any lesions or anything, any moles that might be appearing discolored to you?
No, but I think I'm a bit more pale than normal.
Just related to some of the anemia that you've been experiencing?
It must be, because I'm usually not this pale.
Okay. Have you had paleness? Have you noticed any increased paleness, like in the inside of your mouth? Or it's just like your overall skin tone?
I haven't noticed. I haven't looked.
So any rashes or dryness, changes in that in anywhere on your skin? Any itching? Any history of like eczema or psoriasis or anything?
No.
Okay. So how about your hair? Have you noticed any hair loss recently? With the anemia,
No.
Any patches or anything like that? Changes in your hair texture? No. Okay. And looking at your nails, have you noticed any change in the coloring in your nails related to the anemia? Sometimes that paleness.
I haven't noticed.
No changes. Okay.
I guess they look a little bit lighter.
A little bit lighter. Okay. But I'm just trying to get a baseline for you. Okay. So anything else that you can think of? Anything that you've noticed skin-wise? I know you're saying that you were laying down a lot more. Maybe have you noticed any redness or soreness or changes in your skin from laying down more? No. Okay. Okay, so we talked a little bit earlier about any headaches or anything like that, but have you noticed any neck stiffness or soreness?
No.
Any changes in your swallowing?
No.
No? Okay. And have you noticed any swelling in your lymph nodes here, especially in your neck area?
No, it hasn't felt...
No, not at all? Okay. Okay, so now we're going to talk about your eyes. So you had said that you had surgery, the laser surgery before.
Yes,
So have you noticed any changes in the vision since then?
No.
No?
I need readers now, but...
You do wear glasses? Okay. Do you have your glasses with you while you're here?
They're just over-the-counter readers. There's a pair in my purse.
Oh, okay.
Yeah.
You do have your glasses with you then. Okay, good. So any history of eye infections or conjunctivitis, redness to the eyes?
No, I mean, they can get dry with allergies and itchy with the allergies, but it's rare. It doesn't happen very
Do you
often.
take eye drops sometimes?
Only
for
when I
that?
need to. I mean, if they get really itchy, I'll put some allergy eye drops in there, Visine or.
We can add that to your over-the-counter list, just in case, so the doctor knows that you are requiring that. Have you noticed any excessive tearing with the allergies?
No, it's more dry.
More dry?
When
okay.
It acts up, yeah.
Any halos or blurred vision at all?
No.
Loss of side vision, the peripheral vision?
No.
Any issues while you're driving with your vision?
No.
No? Okay. Or any pains in the eyes at all?
No.
No? Okay, good. Okay, let's talk about your ears. So, your hearing. Any issues with your hearing in one side versus the other? You feel like you hear equally, you're able to hear, obviously, as I'm asking you the questions. The acuity is there. Ever any ringing, buzzing, or dizziness? We talked a little bit earlier about maybe being lightheaded or dizzy with the anemia, but that's not uncommon with allergies as well. Do you ever have that with your allergies, being dizzy or the pressure in your ears changing with your allergies?
No, they'll get itchy actually.
Do they?
Like inside.
Oh, okay.
I know that sounds weird, but it's like they itch deep down
Mm-hmm.
when allergies are bad, like sinus straining and stuff
Oh,
like that.
okay.
So yeah.
Okay. Do you have any exposure to loud noises, or do you wear headphones frequently, things like that?
Only when I work out.
Only when you work out?
Yeah.
Okay. Okay, so now we're going to talk about mouth, throat, and sinuses. We've talked a lot about sinuses so far, so we're going to make sure we document those things. So, any issues with teeth and gums?
No.
Cavities?
Had cavities in the past.
Fillings and those kind of things?
Yeah.
Okay. Any denture appliances?
No.
No? And we asked about the sore throat. Do you have any mouth lesions, sores in your mouth?
No.
Anything like that? Any nasal obstruction at this point?
No.
Okay. Frequent colds and sneezing recently?
Not recently.
Not recently? Okay. And we talked about a little bit of itching of the eyes, ears, and throat when you do have allergies. So that's part of your history, right?
Yes.
Any nosebleeds?
No.
No? How about any snoring or sleep apnea?
No.
No? Okay. Okay, so moving on to our thorax and lungs. So, right now, any difficulty breathing?
No.
Any wheezing right now?
No.
No? Did you use your inhaler today?
No.
No, it wasn't needed? Okay. So no pain when you're breathing?
No.
Taking deep breaths? Okay. And any shortness of breath today during your routine activities?
Little bit when I had to walk from the parking garage to the ER, because it's a long way.
Yeah.
It's a long ways. So I got a little winded then, but not right now.
And maybe related to the fatigue as well, huh?
Yeah,
okay.
I was very tired.
So, do you feel like you need to prop yourself up on pillows at nighttime, or are you able to lay flat in your bed?
I can lay flat.
Okay. Any cough, dry, or coughing up anything?
No.
Any history of respiratory infections, pneumonia, things like that?
I had pneumonia when I was a kid in like junior high.
Okay. But not since then?
No.
Okay. Okay, so we're going to talk about breast and lymph. Any history of any lumps to the breast?
No.
No? Ever any discharge or dimpling in the nipples?
No.
No? Any swollen or tender lymph nodes here in the axilla underneath your armpit here?
No.
How often do you do your own breast self-exams?
A few times a year.
A few times a year? Okay. We definitely want to talk about that. So we'll give you some information in regards to that as well, okay? Um, next, we're going to talk about heart and neck vessels. Okay? So I had asked you earlier if you have any history of hypertension. And so we're going to be checking your blood pressure and your vital signs while you're here in the hospital consistently and just managing that for you. But have you ever had low blood pressure?
No.
Sometimes people may have a lower end of the blood pressure, especially if they are have history of anemia. So we'll be monitoring for that as well. Okay. Have you ever had an EKG where they put the monitor stickers to your chest?
No.
For your heart rhythm?
No.
They'll be doing that as well while you're here in the hospital. Okay. Ever any chest pain or chest pressure?
No.
Any heart palpitations where you feel like your heart is skipping a beat maybe?
Oh, if I have too strong a coffee,
Oh,
it'll beat faster. But
does it?
Yeah.
Okay.
I can't drink those espressos. No.
So the caffeine will
Yeah.
make you give you some heart palpitations.
Yeah.
Okay. Ever any swelling to your lower extremities?
No.
Feet or calves especially?
No.
No? Okay. So, we will check your blood pressure today, but do you remember what your last was the last blood pressure you can remember?
I usually run 117, 120 over 80. That's
Okay.
pretty much been my normal.
And how long has it been since you had that done?
When I went to the doctor,
Okay.
I was thinking of another doctor visit, womanly doctor, but no, they did it when I went to the doctor last week.
Last week.
Yeah,
Okay.
sorry.
Okay. No, that's okay. I just want to see what you know to be your last blood pressure. Okay. So, peripheral vascular system. So, we talked a little bit about swelling of legs and feet, and you said that that's not normal for you to have swelling there, right?
No, I don't have swelling.
Okay. Any pain or cramping to your legs?
No.
I know you said you work out a little bit. Not that kind of, soreness to the legs like that. Maybe cramping in the calves.
If I don't stretch after I work out, then
Do you?
It might cramp my calves, but not normally, no.
Not like that. So when you bring your feet back, your toes back towards your nose, do you have any cramping with that?
No.
Okay. Do we have any sores or any issues down with your toes and in your legs? Ever any wounds or anything like that between your toes or around in your feet? Okay.
No.
Let's see. Now we're going to talk about your abdomen. So, ever any history of indigestion?
I mean, like heartburn?
Heartburn, reflux.
I mean, every once in a blue moon I'll have heartburn, but I'll just take a Tums or two and it's fine.
Okay.
It's once a year or something like that.
Very, very uncommon.
Very rare.
Okay.
Yeah.
Okay. And we asked about swallowing earlier. No issues with swallowing, anything like that.
No.
What about nausea? You ever have any issues with nausea
Usually only when I'm sick.
when you're sick?
I mean, if I have a bug or something,
Yeah.
rare.
And abdominal pains?
No, not really.
You pass gas on a regular basis?
I hope no more than anybody else.
It is a normal function.
I would say normal, yeah.
So it's important to do that. So this is the time when we want you to pass gas, right? This is important. So ever any hernia, any bulges in the abdomen that you've noticed?
No.
No? Okay. And let's talk about how your frequency of bowel movements, things like that.
Usually every day or two.
Once a day.
Yeah, every 1 to 2 days.
Any history of constipation, diarrhea, anything like that? No.
No.
Okay. So now we're going to talk about genitalia. So every history of urinary incontinence, leaking, or when you cough or sneeze, having that stress incontinence of
No.
urine.
No.
Ever any blood in the urine?
No.
Any pelvic pain or perineal lesions?
No.
Have you been exposed to any sexually transmitted diseases, infections that you're aware of?
No.
No. Are you using birth control?
No.
So when was your last period?
2 weeks ago?
2 weeks ago. And about how long? How many days?
5, maybe.
5 days. Okay. And would you consider this a regular period for you as far as flow wise, things like that?
Yeah.